there. My name is Beverly Jacobson, and I'm the founder and president of Verity's Village. We are a nonprofit organization that serves families who receive a life-limiting diagnosis for their babies. And from a personal standpoint, I am the mother of Verity, who is a little girl who has trisomy 18. And with my pregnancy with Verity, we were introduced to a whole new world that we didn't really know existed. And to be honest, it was a scary introduction to that world. And we have learned a lot since then. Our diagnosis came back in 2016, and Verity, as we are recording this, is approaching her 7th birthday, which is a whole separate story in and of itself. But I want to introduce you to a lady that we met almost right away on this journey. Sara Fisher is a genetic counselor at the University Hospital in Nebraska, which is where we ended up delivering Verity. And she served as our genetic counselor through this process. And I will be honest, I would not have been able to tell you what a genetic counselor was before we met her. And so our introduction to her began with her explaining a little bit about who she is, what she does, and what her role was for us in going through this process. So Sara, welcome. First of all, thank you so much for taking time out of your busy schedule. We're glad that you could come and share with our community a little bit about what it is you do and what genetic counselors do. So we'll start with that. What is a genetic counselor and what do they generally do?
Yeah, thank you so much for inviting me today, Beverly. I really appreciate the opportunity to talk about genetic counseling in a lot of different formats. Genetic counselors, we are healthcare providers who have specialized training in medical genetics and counseling. So generally, it's about a 2-year program, a master's degree for most genetic counselors. And there's a lot of specialized training. We're not physicians, but we have a lot of specialized training and work as part of a healthcare team. And I work in prenatal and have worked in prenatal for all of my kind of clinical life after graduate school. But there are genetic counselors who work as part of laboratories, as part of other industries, advocacy groups. They work with patients who are in pediatric clinics, cardiology, cancer. There are so many different specialties. I can't, as long as your arm, there's a list these days, and it's getting to be more and more diverse the longer our profession is around.
That makes sense. That makes sense. So as someone who walked into your office with a suspected diagnosis, then you really were so kind and compassionate, and I will say really made a huge difference in the way our journey started, because I was so full of fear walking in. I didn't know what trisomy 18 was. I really didn't know anything about this whole process. And so if someone, has a diagnosis, or let's say a suspected diagnosis like ours, because we didn't get confirmation until after we had gone through a diagnostic ultrasound, what would be that next step, I guess?
So I think there's a lot of different times that I may meet with families. And sometimes, let me just kind of talk about some of the different time points that I, in at least the prenatal setting, might meet with families. Sometimes it's before any testing is done. Families are just trying to figure out what's available, what's currently available, because it might be different than a past pregnancy even, and kind of walking them through what that is. As genetic counselors, I'm not there to say, you should do this or you should do that, and really just want to help them know what is available to them. And then if they choose testing, help navigate that process. And if they choose not to do testing, that's okay too with us. And so we just want to make sure families get the information that they need to make the decision that fits with their current pregnancy, which may be different from past
Sure.
or future as well. Sometimes we meet families after a testing has been done, either with their provider or with us, and we're meeting either for the first time or again to really sit down and talk in more detail about what does that testing result say. And often that's screening results, not something that says a clear yes, no answer like you had gotten
Right.
later. And so trying to, again, kind of very clearly, as best as possible, give information about what we know at that moment and how do we get more information if families want that. Sometimes it's after ultrasound findings makes us suspect something, and we're trying to help explain what is that in understandable language, get support resources, and help families kind of just know what's available to them. Other times we don't meet with them until after a diagnosis is made, and then we sometimes backtrack and go through some of those other steps along the way to try to help them understand, how did we even get here and how do we move forward with this brand new information.
That makes sense. And actually, I'm glad that you approached it that way because it does make me kind of back up. I had my own experience, but that does bring up a question. And I'm sorry we didn't really discuss this beforehand. We kind of went through some questions. So let me give you time to think about it if you need to. But something that comes up a lot in our community is the non-invasive screening. So
Yeah,
NIPS, non-invasive prenatal screening or prenatal tests. And a lot of families come to Verity's Village or they're coming for support with only those results,
test results.
if you call them results.
Yeah.
So explain if you would, what should we be careful of, or what should we be aware of as far as the non-invasive screening? Because it's
Absolutely.
kind of the starting point, really, isn't it? At this, you
Yeah,
often it can be the
it's the
starting.
newest option of testing, but it's also the most accurate, but it still is only a screening test. And that's really good points to bring up, is that it is not a diagnosis. It's not a clear yes, no. And depending on families' either age of the pregnant patient or their pregnancy history, that test result may be more or less likely to be a real true positive. So if you're coming in at a very low chance and you have that test result saying there's a higher chance, it's not as high as someone who's already had maybe a child with that same diagnosis, or there is maybe a higher age for mom that might be already telling us there's a higher chance or possibility. And so we have to take all of that into account when we're explaining that test result and saying, based on that result, the lab estimates if we move on to more testing, is it a 50%, a 70, a 90% chance that we would confirm a diagnosis? And for some families, they're not ready to go right to diagnostic testing with a CVS or amniocentesis. Some want to start with an ultrasound and figure out, is there anything else on ultrasound that makes us even more likely or more suspicious? Or do we want to even wait till testing after birth? So there's several different kind of paths forward after that NIPS or NIPT type of test result.
That's really good to point out. And as you're talking, I can think of families and situations that we have served, and they've made all those choices. Some have decided for whatever reason not to do any testing until after birth, and we have had some families actually have joined our community because they received a diagnosis after baby is born. And so then they're saying, okay, kind of, what can we do to walk alongside them? So I think that's so valuable and empowering for parents to realize there are a lot of different unknowns, a lot of different factors, but all of this, they can walk with a counselor, if they so choose to to
Mhm.
to do that.
Yeah.
And it's kind of like, what would the right next step be for them? And so
Mhm.
for us, it was, you know, talking with you about why did they suspect trisomy 18 or Edward syndrome
Mhm.
as opposed to Down syndrome or a
Mhm.
different, diagnosis, which we don't need to get into all the nitty gritty of that. That I remember that being very complex, and yet somehow you made it understandable in the moment. So it answered my questions then, and I've told people I could not recreate that conversation. I don't know what you told me, but it made sense, and it really, I don't know, it was just comforting.
Mhm.
There's science, and yet there's still some probability and some unknown. So for us, our next step was a diagnostic ultrasound. And I remember you walked us through some of the markers, I guess, the soft markers that they might be looking for. And then for us, you had also kind of outlined, okay, what might come after the ultrasound if we so chose. And we did choose an amniocentesis, and I won't get into all of that, but I do have a lot of families who ask what is an amniocentesis, and then is it CVS? Was that the other one that you mentioned?
Yeah.
Are those two different things? What do
Mhm.
they do? and then
Mhm.
maybe pros and cons.
Yeah, yeah. I think those are common questions we get from families because they're not tests that are done every day in pregnancy. I think years ago they were more routinely done because we didn't have as many screening options. And so more families were choosing to go right to diagnostic tests because we didn't have as many things available to us. And the NIPS type of testing and even ultrasounds have gotten so much better in the last few decades that families often start with those because they're low risk for mom and baby. That's what I hear most often, I think, when families are kind of leaning towards screening as a first step versus going right to a diagnostic test. But some of that also is insurance as well, can sometimes
Mhm.
be a barrier because not all insurance companies would cover diagnostic testing like CVS or amniocentesis, but that's a whole nother conversation. CVS and amniocentesis are two separate diagnostic tests. So in pregnancy, if you want a clear answer about chromosome conditions, it doesn't tell us about everything. I tell families that all the time, but it's going to tell us whether there may be the typical 46 chromosome number or if there's an extra missing chromosome or large pieces that might be extra missing. So there's some limitations to it. And both have different times in pregnancy when they're available. CVS is done usually in the late first trimester, and amnio is usually after 15 or 16 weeks, but each of those depend on the provider performing those procedures. It's always done by someone with specialized training, and that is something that they give their own risk numbers. So families should ask specifically about what is the risk for complications, what is the time to get those results, what is the cost of testing at their individual location. So, but test results generally can take anywhere from a week or 2 weeks, sometimes longer, depending on the type of testing that's ordered. And some families, like I said, go right to that if they're really needing a yes no answer because they're coming in. Maybe they've already had a child with a diagnosis and they've been on a different path before and they really need that clarity as soon as possible. And other families, it's never an option because they're not interested in any procedure that, even with a small chance for complications, that they might not consider that as one of the things that is important to them as a family. So um, I hope that kind of briefly describes each of those. I won't go into other details, but
No, that's very helpful. And yes, I think it is because we see those terms kind of thrown out there, and sometimes they just. As a military spouse, I got used to a lot of acronyms, and so as you know, there's a lot of lingo to learn in the medical world as you're navigating through all this. I think that is very, very helpful. And even, my own experience, I had two different pregnancies, Verities, of course, and then I had another one earlier when I was a much younger mom with suspicious findings, and I chose different paths with both of those children for different reasons and based on conversations I had with our medical provider. So it's very important to understand there is no one size fits all answer in this world.
yeah. And I will add as well, depending on where you live in the US and elsewhere as well,
Mhm.
can really also depend on what options of testing you have available to you, both screening and diagnostic. Some of that is just training of the providers, some of it is hospital policies. There's a lot of different reasons, but just something important to keep in mind is that you just need to ask what's available in your area, and you may have to travel in some cases several hours for
Mm.
some of those procedures, even though they're often just done in the ultrasound area or the clinic, the outpatient setting.
Okay, thank you. Another question, a couple of questions, I guess they're related that had come in, and
Mhm.
I think you kind of touched on this as far as, you can meet with parents at multiple points through their journey. But one mother asked, when should people ask their OB about seeing a genetic counselor? And then along with that, do you need a referral to
Yeah,
visit you?
those are great questions. I think that when I talked before, it was along the lines of primarily like in pregnancy, first, second trimester, sometimes even into third trimester, if there's some new ultrasound findings or new, like a baby's not growing quite as well, and we're now trying to figure out why that might be. But more often we see families in the for end of the first and the second trimesters most commonly. But we can also see families before or after pregnancies. And that's something I didn't point out before, is
Mm.
that, for example, if a family has a certain family history that they have questions about and they want preconception discussion, there are some genetic counselors that can also provide that as part of OB clinics or part of other clinics like general genetics clinics. And also after pregnancy loss, we always, want to still provide families with really updated information on what we know, what we don't know from any testing that may or may not have been done, or imaging studies like MRIs or other things, and try to get information for families who say, what is the chance or possibility this might something similar happen to us in a future pregnancy or for other relatives. And so not just in pregnancy, but around pregnancies, we meet with families as well. And then the referral question, it really depends on both the clinic setting as well as the insurance, because there are some insurance like TRICARE that requires referrals, but they also are doing that partly to make sure that patients are being referred appropriately for specific reasons, that genetic counselors might actually see them and be able to help them with different indications. And so part of it is a little bit of a barrier in some ways, but it's also making sure that families are going to the right place, as well as some locations might have similar kind of reasons for referrals. They require referrals because they also require, as part of that process, medical records being sent from the other location before that patient is seen, so that they're not seen without the information that would be most valuable to help those families along the way. So not always required, but there is sometimes some really good background reasons for that little bit of hiccup in the road sometimes.
That makes sense, and to be honest, that part of my pregnancy with Verity is a total blur. I don't even remember. I just remember we showed up in your office for the
Yeah.
day of that ultrasound, and I remember very vividly the phone call that preceded that, and I remember our time with you, but it was a blur. So apparently things happened behind the scenes, and it got taken care of. But it's good for people who are entering into this, and they are needing to have maybe more conversations with their provider, and take those steps. I think our last question that was submitted is, there was a lot that went into it. So I'm just going to take the personal experience out of it and just go to the nutshell, which was basically, she was wondering, are there times when genetic testing, to go through the diagnostic process to confirm a suspected diagnosis, are there times when that could actually work against parents?
I think that that can depend on the situation. And I think that I definitely have heard from some families those experiences where a diagnosis in pregnancy they felt like maybe wasn't as helpful to them individually, because it felt like closed some doors for some families. And this is after speaking with several different families. And this may not be just in my area, it could have been other families in other areas that I've spoken to as well. Because I think part of this goes back to how medicine, I feel like, slowly changes. And so there are some things that has taken quite a bit of time for some of those words and phrases that are maybe not as acceptable nowadays, that related to trisomy 18 or trisomy 13 or other conditions that may have multiple complicated health concerns. I think that the wording and the phrasing is changing a little bit, and for a good reason. But I think there's still some kind of educational processes that are slow to change, to say really that if there are a diagnosis, that it used to be that there wasn't as many interventions available. And some of that, as I was looking through some old literature and medical research, is that some of that was related, honestly, to hospital policies. Sometimes providers' hands were tied if there was a specific diagnosis and they wanted to do intervention, but there were already policies that said we can't with that diagnosis.
Mm.
Versus, is it something that's changing over time, that there's been more data to say we should be, even with several health concerns, resuscitating babies, where that was something just for many, many years that just was not commonly even considered. And I hate even saying that out loud, that those were things that in the past, but I think it is a slow process to change in some areas quicker than others. And I think that there's been some good studies, good research studies, especially in areas of cardiology, that have said that, we should be offering families some of these different interventions that we might not have previously done. But it's also looking at their unique history too,
Right.
and not just the diagnosis. Because surgery for a baby who has a trisomy 18 diagnosis, maybe without a lot of other health concerns, is maybe a little different than a baby who has a lot of other complicated health, learning, or growth concerns along with their diagnosis. So we're trying to, I hope, um, change that narrative over
Mhm.
time. And the more we talk to um, all different providers about that narrative, I think that's giving me a hope for the future of a little bit better outcome for families. Because
That,
that's definitely, it is something important. Sorry to cut you off, but
yeah.
it is something important that families will, some of the literature says families want open and honest communication, but they want it done with an empathetic voice, and
Yes.
they want us to be thoughtful about our word choices. And I think those are important things that we need to think about as well.
Well said. I love that we didn't even talk about this, but you use some words that actually are part of the vision of Verity's Village, which our big grandiose vision is to change the narrative surrounding genetic anomalies from heartache to hope. And we know that the outcome is not always favorable. It's not always what we want. There is, there are hard situations, there's grief, there's loss, and yet there can be beauty in those little lives, however long they are. And I was just going to close with a big thank you to you, because I remember our second visit when we had that confirmation of the diagnosis, and we came in, and you shared a video of a little boy who had the same diagnosis, and you shared some other things, and you said, I'm going to give you the positive, as much positive as I can find, because I know you're going to hear the negative in other places. And I felt like even that one visit with you, with seeing even a potential of a different outcome than what I was kind of dreading, was enough to give me some hope to cling on to. And then we started finding other support groups as well. But I know you are very careful and deliberate with your words, and I think you do your clients just such a wonderful service by kind of just, here's the information, and just your gentle, compassionate demeanor, I think, has made a world of difference for those you've interacted with. So thank you so much for sharing with us your expertise. And of course, there are lots of specifics that we would direct parents to go to their providers and their teams. You can, get connected with others who have walked this journey, but, just be careful that you don't grab someone else's story and assume it's going to be yours, whether it's the same condition or, as you said, many different things to consider. And the same diagnosis is not going to present in the same way with
Yeah.
every family. So, is there anything else you would want to share with families as we're kind of wrapping up? Anything you would want them to know?
Well, I think there's one thing that, because genetic counselors are not available everywhere and families may not have an easy way to connect, I do recommend the National Society of Genetic Counselors website, so nsgc.org. You can look on that website. There's a little flag on the main page where it's find a genetic counselor. And so you can find by zip code, state, even specialty, who you're looking for. Because while I work in prenatal, there are genetic counselors for a lot of different specialties, as I mentioned. And so if right now you're needing prenatal or someone related to kind of linked with pediatric, there may be other times in your lifespan you need a genetic counselor for other reasons. And so we want to make sure that you have those connections and know how to navigate that, even if your providers may not have that in your particular area.
Very helpful. I did not know that. I wrote it down. I'll make sure that we put the link in our notes at where we share this. So Thank you again, Sara Fisher from UNMC, and I'm Beverly Jacobson of Verity's Village.